An outbreak can start quietly. It might begin with just a few unusual cases, a handful of patients who show up with similar symptoms, or an odd pattern in one community. But when those numbers rise above what's expected, public health professionals call it an outbreak. An outbreak is the occurrence of a disease within a population that exceeds normal expectations. It doesn't always have to involve an infection. Outbreaks can be caused by communicable diseases, toxic exposures, or even unknown environmental factors. In other words, it can spread from person to person, from animals, or through something in the environment, like contaminated food or water. When that outbreak spreads wider and faster, beyond one small group, it becomes an epidemic. An epidemic means there's a significant increase in the number of cases of a specific disease within a region or community. The rise is far beyond what would normally be expected for that population. Several factors influence how fast and how far an epidemic spreads. These include pre-existing levels of disease in the community, environmental changes caused by the disease or disaster, population density and displacement, disruption of utilities, healthcare services, and sanitation. In simple terms, when people are living close together with limited access to clean water, hygiene, and healthcare, an outbreak can quickly turn into an epidemic. For a true epidemic to occur, three things must exist: a vulnerable population, a disease agent, a mechanism for large-scale transmission. When those three factors align, the result can be devastating. Epidemics require immediate response and intentional planning because they can lead to loss of life, economic collapse, and social disruption. Public health officials usually declare an epidemic an emergency if any of the following occur: a large number of projected cases. The disease leads to serious disability or death. The outbreak threatens to cause social or economic disruption. Health systems can't manage the surge in cases or lack necessary resources such as vaccines, medications, or testing. There's a high risk of spreading internationally. When an epidemic spreads across multiple countries or continents, it becomes a pandemic. Pandemics affect much larger populations and often lead to significantly higher death tolls. In March 2020, the World Health Organization officially declared COVID-19 a pandemic. That moment marked a turning point in global awareness, an acknowledgement that the outbreak had crossed borders, overwhelmed health systems, and changed how the world functioned. So how do we know when an outbreak is happening and what's being done to stop it? That's where public health surveillance comes in. Surveillance is the continuous collection and analysis of health data. When health departments, clinics, or hospitals begin seeing clusters of unusual illnesses, those patterns are reported. Epidemiologists, often called the disease detectives, begin investigating. They use interviews, questionnaires, and sometimes home visits to trace where the illness started and how it spread. For example, if several people from different neighborhoods all eat at the same restaurant before becoming ill, the restaurant might be the common link. The goal is to identify the source of the outbreak and contain it as fast as possible. Containment can involve isolating infected individuals, providing prophylactic treatment to contacts, cleaning or disinfecting environments, and sharing timely public health information. An outbreak is officially considered over when the number of new cases drops below what's normally expected for that population. In other words, when the numbers return to baseline, the crisis is controlled. For nurses, understanding these definitions isn't just about terminology. It's about preparedness and responsibility. Nurses are often the first to notice unusual patterns in patient symptoms or community trends. Recognizing early warning signs, reporting them promptly, and educating patients about prevention can stop small outbreaks from becoming large-scale epidemics. In a world that's constantly moving, through travel, trade, and technology, diseases can spread faster than ever before. That makes the nurse's role in detection, communication, and patient education not just important, but essential.